India could be dealing with a COVID-19 infection tally that's 10 times the official figure. Coronavirus cases among adults are rising sharply in the country. Officially, 6.2 million people have tested positive, but a new study shows that the real picture might be far worse.
1 in 15 people in India over the age of 10 could have contracted COVID-19. That's the findings of a nationwide study measuring antibodies. It found that more than 60 million people could have already fought off the virus, more than 10 times India's official tally. The blood tests were collected from nearly 30,000 people from mid-August. It found that people in slums were far more likely to have been exposed to COVID-19 compared to other urban areas and even rural India.
Seroprevalence was not different by age or by gender. So it does not, all age groups above 10, we have found that it is there. Earlier we were under the impression that below 18 it does not affect, but we found now that there is no difference. Risk gradient is more, urban slum is highest, that is 15.6%, compared to urban non-slum, that is 7.6%, compared to rural areas, which is about 4%.
India has the world's fastest growing COVID-19 outbreak, and experts warn the upcoming religious festival season could make things worse. So could an election next month in Bihar, where more than 70 million people are expected to cast their vote.
Neha Punya is live in New Delhi for us, and she joins us now for more on this story. And Neha, we're seeing alarming statistics then, but the government believes that the situation is under control?
That's right, Steve. That's something that the Indian government has been saying for many months now. And even in the month of September, where India added 1 million cases in 11 days, the government said that it feels like it's handled the pandemic well and the situation is very much under control. This is despite that serological survey that you just referred to, which the government conducted itself. That survey found that the actual presence of the COVID-19 pandemic in India is much larger than what the government data is letting on, 10 times more, which essentially means that for every one person who is being detected and treated, about 20 to 30 people are not getting detected by the system. But despite this, the government says that because India's mortality rate is low at much below 2%, India is doing a lot better than many other countries. It says its aim is to eventually bring the death rate to even under 1%. But even here, many critics argue that this isn't the full picture. For several weeks now, India has been recording 1,000 deaths daily. And even here, critics argue that not everyone is being accounted for. In many instances, if someone has a pre-existing health condition and they die of coronavirus, their death is not being counted and not being added to the official tally. And this is a concern because every time the government asserts that the situation is under control, that there's nothing to worry about, it's essentially leading to people, lowering their guard, going out without masks, not maintaining safe distancing. And that's why India is stuck in this cycle. And the predictions for the country are grim. Without a vaccine, it's forecast that India could have millions of cases every single day by early 2021.
And Neha, as we struggle with the true picture of just how many infections there might be in India, we are expecting more restrictions to be eased shortly.
That's right. Today, Dawn, is the last day of the current restrictions. The month of September was one where a lot of activity was suddenly allowed by the Indian government. You had urban metro services restarting. You had schools partially reopening in many parts of the country and interstate travel being allowed once again. And a result of this is, of course, a surge that I was mentioning earlier. Despite that, the government is going to go ahead and ease more lockdown restrictions either today or tomorrow. And we're given to understand that in October, swimming pools, cinema halls, entertainment parks could be allowed to reopen. There could also be more relaxations in order for businesses and marketplaces as the government tries to put the economy back on track and encourage people to spend more as the festive season is just around the corner. But experts are warning that this easing of lockdown restrictions, while aimed at rebooting the economy, could come at a heavy cost for India, because every time there has been a lockdown relaxation, cases have significantly surged. And to make matters worse, especially here in northern India, we're already seeing air quality levels dip. And experts are warning that as smog season comes around, there will be more complications. COVID-19 cases could get more severe for people who have breathing issues, which will mean that India will need more ICU beds in the future.
And thanks for getting us up to speed with what's happening in India. Neha Punya speaking to us there from New Delhi.